Okay, we're back with the 80s hits and Simon's Anatomy. So we're going to talk about the kidneys. So in this slide, I'm just going to point out a few features. We're going to point to them. We're going to try and guess what they are. Don't be impressed. I'm just reading off the page right next to me. So first, I think we should recognize the muscle layers, and so we're going to point and try to recognize what they are. So first, on the very outside, we have the external obliques, and the next layer is the internal obliques, and then next is the transversus abdominis. So going back again, the internal obliques and the external obliques. On the other side, we can see the body of the lumbar vertebra. And let's look here, the same thing over here. We can see the external obliques, the transverse abdominis, and the internal obliques, if I'm hitting them right. But we're going to be talking about the kidney, and this is just an introduction, but we can see some things here. For example, this is the renal hilum, this is the peritoneum, and this is the latissimus dorsi. So let's continue. Okay, we're looking at the kidneys, and in relation to the rest of the body, and we're trying to figure out where things are. So we're just going to be pointing at things and trying to guess where they are. So this is the diaphragm, and right here you would have the liver, and this is trying to point to the spleen, and we should know that it's between T10 and T11. And this here is the transpyloric plane, the left kidney, and this is the 12th rib, and we should recognize the ureters and the iliac crest and the ilium itself, and also this this dimple, which is indicating the posterior superior iliac spine. Okay, let's look at this picture. So we're looking at the kidneys again in relation to other parts of the body, but trying to recognize certain features. So here we notice the inferior vena cava, and we can also notice the spleen over here, and let's see, the suprarenal gland, the esophagus and left gastric artery is here. Let's look for the duodenum. Here's the duodenum. Just the basics here, folks. What is this? This is the root of mesentery of the small intestine. What is this? This is a ureter. What is this? This is the superior mesenteric artery and vein. And what does this contact? It contacts the small intestine, the jejunum. Alright, so we've looked at the main features of this slide. Let's look at the next one. Okay, we're looking at another picture of the kidneys. Although it looks like a funny cartoon character here, what we're going to do is I'm going to name some things, and then we're going to try and find them. So first, let's try to find the left testicular artery. Where's that? That's right here, the left testicular artery. Now let's find the right testicular artery. That's right here. And next, let's look for the common iliac lymph nodes. These are the lymph nodes. And let's look for the branches of the left superior vesical artery. Right here. And where is the inferior mesenteric artery? That's right here. How about the accessory left renal artery? That's right here. Okay, next, the right renal artery. Okay, that's very easy. And then we have these suprarenal glands. And we should know that this is which vertebra? It is the L1 vertebra. And up here, it looks like hair, but actually it is the aortic hiatus in the diaphragm. And this is, of course, the anterior view.